We're all good to go? All right. Dr. Morrison, you ready? Well, good afternoon, everyone. Dr. Morrison and I are here to provide you with an update since yesterday on the recent cluster of cases in the Charlottetown area, in particular those connected to 2 schools. Since Saturday, our testing clinics have conducted 1,320 tests for individuals under the age of 19. So to all those who quickly responded to the call to be tested, thank you very much. And it's further evidence of the support of Islanders in these difficult times to do everything that they can do to help us contain the cluster. Dr. Morrison will be providing further information about those findings in a few moments. I just want to say that over the last few days that public health officials have been working very diligently to contact trace and to test as many individuals as possible as we seek to avoid the further spread of the virus. The key to wrapping our arms around this outbreak is, like we have done in the past, is ensuring anyone, and we mean anyone, who has any symptoms to get tested. The more tests that we're able to conduct in the next 48 hours will help provide an opportunity to break any possibility of further transmission of the virus. As we said yesterday, we never want to disrupt school, but every time over the last 19 months that we've moved hard, but we moved quickly in an effort to prevent the spread of the virus, it has worked. And that's what we're doing in this case, and we're hoping that we will have a similar success. By limiting our contacts, it will allow public health the time it needs to isolate close contacts and to break the link of transmission. Since yesterday, as we announced, government has been working to initiate a number of programs, beginning with the delivery of food supports to island families who might be impacted by the school closures in the Charlottetown area. Anyone who hasn't been able to access this program, who needs to access this program, can register online, or they can call the following number, 902-213-5506. The provincial government has also made some changes today to the COVID-19 Special Leave Fund, as we indicated yesterday, to broaden its criteria for anyone who may need it as we work through these next few days. If you're not able to get to work, not able to access childcare, we've made arrangements in the Special Leave Fund to assist those who may need it. And those links are being shared now, as I understand, on the government website, as well as our social media channels. And I would just remind others that there are federal supports as well that kick in really, really quickly if they are needed as well. And just before I turn it over to Dr. Morrison, I did want to take a moment to address what was scheduled to occur today at the Queen Elizabeth Hospital in terms of a protest. While I wholeheartedly support the democratic process and the right for Islanders to assemble peacefully, to express their opinions and views, I don't support the individuals choosing to protest at our hospital, our main hospital, the Queen Elizabeth Hospital, where Islanders go when they are sick or worse. I think it is completely and utterly unacceptable. Your views and your opinions, they belong to you. The hospital that keeps us safe and healthy, that belongs to all of us. It's not the place for political protest. To the healthcare workers who are seeing these protests when you come or leave work, I think on behalf of all Islanders, I say I'm sorry you have to be witness to that. You should not have to see this as you go to work, doing your incredible work each and every day to keep Islanders safe and healthy. And the care that you provide Islanders, in particular these 19 months, has been exemplary, has been over the top, and you are worthy of so much more than what is being inflicted upon you there today. I would ask those who are participating in these protests to find a more suitable place to express their opinions. I understand you have some challenges with what has been taking place in this province, and it is your right fundamentally to express those views. You should just show a little bit more class in where you choose to share those views. So with that, I'll turn it over to you, Dr. Morrison, for your update.
Thank you, Premier. And good afternoon. And this is really just an update focused on the cases and the situation that has evolved in the last couple of days. And as we mentioned yesterday, as information becomes available, it will be shared with the media and the public. Today, I am announcing 5 new cases of COVID-19 and PI that came in overnight and early this morning. 4 of these 5 new cases are in those who are less than 19 years of age. 1 is an individual in their 60s who has a history of travel outside Atlantic, Canada. This individual is self-isolating and contact tracing has been completed. 3 of the new cases are at West Royalty Elementary School, and all are close contacts of previously announced cases. 1 is a new case who is a student at Charlottetown Rural High School and is a close contact of the previously announced case at that school. So to date, there are 8 cases associated with West Royalty Elementary School and 2 cases with Charlottetown Rural High School. Fortunately, most of these individuals have mild symptoms of COVID-19, and there's no one in hospital with COVID-19. Many of the students at Charlottetown Rural are fully vaccinated, which provides more protection to the entire school population. Anyone at the school who is identified as a close contact and receives a call from public health should be tested and isolate as directed. In addition, any staff or students at Charlottetown Rural who are not fully vaccinated should be tested tomorrow at one of the health PI testing clinics. It's not necessary for all students and staff to be tested if they do not have symptoms. Again, Charlottetown Rural High School staff and students who are not fully vaccinated, which is 2 doses plus 14 days, or those who are identified as close contacts by public health should be tested tomorrow. So we've announced really over the weekend 12 new cases, and if you include the cases that we announced on Friday, 16 new cases. 11 of these new cases have been in children under the age of 19. Many of these young people are not eligible to be vaccinated because they are under the age of 12. The investigation into the school outbreak at West Royalty Elementary School continues. At this point, we have not been able to link this outbreak or the cases at Charlottetown Rural to the West Royalty School or either of the cases in either of the school to outside the province. We are considering these situations to be associated with community transmission. And as we said yesterday, we'll know more about the extent of transmission over the next few days. But I do expect there will be more cases. As of early this morning, there were more than 270 close contacts who had been identified, and by end of day, I expect there will be more than 400 close contacts. So in total, we have 19 active cases of COVID-19 in the province, and now all are in self-isolation. Public health staff continue to investigate all new cases with contact tracing, testing, and providing direction regarding isolation requirements. Confirmed cases are required to isolate. Close contacts are being identified and will be required to test and self-isolate, especially if they are not fully vaccinated. All cases and close contacts will be spoken to and contacted directly by public health. As the Premier mentioned, since Saturday, over 1,300 tests have been completed, and that includes PCR and point-of-care tests, our ID molecular now tests under the age of 19. But we do have 680 of those tests pending as of noon today. So that means that swabs have been taken and we are waiting results. I ask that any island resident or visitor in our province with even mild symptoms of COVID-19 to be tested at one of the health PI testing clinics. The best thing we can do to protect ourselves and others from COVID-19, including the Delta variant, is to be fully immunized. We know that being fully vaccinated decreases the risk of hospitalization and severe outcomes and lowers the risk of transmission. Since January 2021, 93% of our cases of COVID-19 and PEI are in people who are unvaccinated or partially vaccinated, and 7% of our cases have been in people who are fully vaccinated. As of Saturday, September 11th, over 247,000 doses of COVID-19 have been administered in PEI, and 92.2% of eligible island residents have received at least one dose of vaccine, and 83.7% are fully vaccinated with 2 doses. Approximately 42,000 people in PEI, however, are not fully vaccinated, and that includes 30,000 who have not received even 1 dose of vaccine. We have received information late last week from the school system regarding the vaccine status of staff at our schools across the province. Overall, the vaccine rate among staff in the education system is very good, average of 90%. However, it is not 100%, and it is not high enough for me to be comfortable. So we have now initiated discussions this morning with education for next steps, and those next steps include discussions around being either fully vaccinated or undergoing regular testing. Other areas of discussion include enhanced testing at points of entry and masking. There are a number of public notifications, and certainly we'll put this information on the website as well. Wednesday, September 8th at Angel Nails on 75 Kensington Road in Charlottetown between 2 and 3. Wednesday, September 8th, the Trailside Concert Hall, 155 Kent Street in Charlottetown between 7 and 10 p.m. And Friday, September 10th, at the Brighton Clover Farm, 20 Century Terrace in Charlottetown between 7:30 and 8. And again, if you are fully vaccinated, please pay, and you were at any of these public locations, please monitor very carefully for symptoms and get tested if you have any symptoms. I'll speak more about it certainly, and we'll put more information on the website. Last Friday, the National Advisory Committee on Immunization recommended a 3rd dose of COVID-19 vaccine or booster for individuals who are immunocompromised. And PEI will be implementing NACI's recommendation, and we have sent information out to our immunizers and our physicians, nurse practitioners, and our vaccine clinics, and we can certainly have that information available on the website as well. I will note, just as we're talking about other cases, for people's awareness, New Brunswick has announced, I believe it's 122 new cases today, and Nova Scotia 73. So certainly an increase in cases that we're seeing in our neighboring provinces as well. It is always stressful for individuals when they learn they have been diagnosed with COVID-19 or have been named as a close contact of a positive case. It's especially challenging for children to isolate and also for their families. Thank you to everyone in PEI who is isolating as a result of having COVID-19, being a close contact, or as the result of travel outside of PEI. A special thank you to children and their families who are isolating. And thank you for the steps you are taking to keep yourselves and others safe and helping to prevent the transmission of COVID-19 in our province. So as we end all our press conferences, as we continue to navigate through this particular part of COVID-19, let us continue to be patient and kind. So thank you.
Thank you very much, Dr. Morrison. We have some questions from our friends in the media, a couple who are in studio with us here, so perhaps we would start with those, and maybe Stu from The Guardian.
Afternoon to both of you. I guess perhaps Dr. Morrison, I'll start with the data that you mentioned about the teachers and staff. I assume that that's island-wide, but can you tell me a little bit more about that data? And I guess looking at the West Royalty and Charlottetown Rural, can you tell me a little bit more specifically about what the levels were at those 2 schools?
Well, I mean, I think I mentioned that overall, when we look at it, is those are rates from across the province, and they include both the public schools branch and the Commission Scolaire de Langue Française, so both. And there's a range of when you look at the staff rate, vaccination rates, and they range from 71% to 100%. And we have But I was particularly looking at the number of schools across the province, and what I wanted to see was how many were above 95%. And the number above 95% is not as high as I would have wanted it to be. And now some schools have small numbers of staff, so even having a couple of staff not vaccinated really impacts that rate. So similar to other provinces, similar to what's been happening at our post-secondary institutions, long-term care, community care, we would want to have that discussion about a vaccinate or testing policy, which we put in place a week ago, or just over a week ago, in long-term care and community care. So the rates, from my recollection, because I looked at the 64 schools across the province, I don't think I can, off the top of my head, tell you about those individual schools in Charlottetown Rural and West Royalty, but both were very good from my recollection. They were not the ones that jumped out at me as being of concern. But I'm looking at all of them because we're trying to protect all the children everywhere, and I know that that's what the staff want to do too. So if we are able to do one more measure to put that in place, but those discussions started later this morning with education from our office.
And I guess just to follow on that, I mean, is it known? So we don't know what the origin case would be, I guess, but in terms of likely factors that contributed to the spread within West Royalty, I mean, do we know if cohorting was in place? Was it a physical distancing issue? Do we know anything about air quality, whether that may have played a role? Is there anything that sort of stands out about the spread, I guess, and what you do know about it?
Well, I mean, I guess a couple of things. There's no indication it has anything to do with air quality or ventilation. I think it's interesting that actually that the cases that have been identified so far are all really would have been in one cohort or have a very similar kind of, they're all connected. So that is, and they all do have that connection. I think we do have to assume it's the Delta variant that is quite transmissible. And I'm not sure we'll ever be able to identify a source. I think we know that the cases have been going up across the country, and we know that this virus is certainly more risk for those who are not vaccinated. But I mentioned that one of the things we're also looking at, and the Premier and I have talked about this, is even enhancing our testing at the points of entry, and we will be making that kind of further announcement in the next day or so, as we balance out our capacity as well as trying to protect the island. I mean, we said with our team this morning, we're going to get through this, and I know we will. And we have to just look at what we have continued to do, and the Premier references to. We've continued to try to do everything we can to protect people who live here in Prince Edward Island. That's our students, our vulnerable older adults, and we're always trying to ask the question, what can we do to make sure that we're safe? And we have to base it on the evidence we have at the time. It's certainly, we don't want to put measures in place that we don't need to put in place, but we have to make the best decision we can with the information we have, and adjust accordingly. And that is something I think we do here. We're able to adjust when we need to. Sorry, long answer there, Stu, but hopefully that helped.
I guess just a final. Sorry, go ahead,
No, I
Premier.
was going to say, go ahead. No,
Last one for me. I guess directed to the Premier. So, of course, acknowledging there's no evidence that this is caused by air quality. However, other provinces have invested in portable air filtration devices equipped with HEPA filters. Ontario, I think, has either a HEPA filter or a portable filtration device in every classroom. given that this is, another outbreak, do you feel that it is time that the province invested in those types of filtration devices in each classroom?
Yeah, I guess, and Dr. Morrison and I talk about this, among other things, on a somewhat regular basis. I think that, all of these ventilation systems in our schools are well above what is an acceptable national standard for sure. I know there's a federal fund that's now in place, and we have indicated that we would tap into that fund to do some upgrades, but those upgrades would be more from the perspective that we have a federal pot of money to access to do so, as opposed to a direct and immediate response for COVID-19. But I think every jurisdiction, Stu, has gone about this a little bit differently. I think that, Dr. Morrison and I talked just as early as this morning that, it's the spread through droplets that is continues to be the way this virus is spread from person to person. And the reality is that this is with us. We're not through this, even if we're tired of it and want to be through with it. And part of the process of living with it is learning to live with it. 0 cases has never been the goal. It's an impossible goal to reach to, But having said that, we want to limit this as much as we can, and that's why we have our different protocols in place, and they're adjusted accordingly. But, I think from a perspective of ventilation, I think that, our schools are above a national standard, and we're happy with that. Yeah. You done, Stu? Do you have more? Okay. Brian?
Here's a question for Dr. Morrison. If I understood your comments correctly, I think you said that the Charlottetown rural cases and the West Royalty cases do not appear to be linked to each other. Neither are they linked to known travel outside the province. So I think you said that it seems to be community spread going on here. I'm wondering if the Delta variant is confirmed, and how significant is this community spread? Are we moving into sort of a new a scenario for dealing with this here in Prince Edward Island?
Well, I think there are a couple parts of your question. We don't know for sure if it is the Delta variant yet. I mean, it is being, the samples are being sent off to the National Microbiology Lab, but it'll be a few days before we would get those back. But based on how quickly, even amongst the cases, it seems to have transmitted, I would certainly assume that it is the Delta variant. And the majority of the cases in the country now are the Delta variant. You're correct. At this point in time, we haven't not identified a link between the cases at the rural and the cases at West Royalty. Maybe we will, but certainly not yet. And we have not identified a link to travel. I think that's partly why we've done this, trying to, in the Charlottetown area, have schools pause for a couple of days so we can really try to get more testing done to understand the extent of the transmission, not only within the schools, but also in our community. Are we seeing any transmission in our adult population as well? So I think it's learning the extent of this community transmission. We are really hoping that we can limit that. And I think it's a reminder to all of us that, as the Premier said, we may be wanting to be finished with COVID, but it's not finished with us. And when we look at the modeling across the country, it certainly indicates a large fourth wave, primarily driven by unvaccinated individuals, but impacting those not only who are unvaccinated, but also who are vaccinated. And we need to pay attention to that and try to, and the Premier also said, we're not trying to have 0 cases. We know that is not realistic probably or feasible, but we need to limit our importation and limit the transmission. They've been our goals all the way along, and we will need to continue to do that because we can protect then the people who may end up in hospital. We don't want to have people who are sick and having to have severe outcomes. And so we'll do everything we can to try to continue that, what we've been doing for 19 months.
And another question for Dr. Morrison. Are we headed towards mandatory vaccinations for teachers and staff at schools? You said you're talking to education people. What are you talking about?
So, and thank you, because I think that should be clear. What we're talking about is a similar policy that was put in place for our long-term care and community care staff a week ago, that if they are unable to be or choose not to be fully vaccinated, then they would be tested on a routine basis. But that is discussion, and we will certainly need to have that discussion with lots of stakeholders and with education, but that's, I think, what we're started to do.
One more, if I may, for
Well, that's the price of coming here, I think. So yes, absolutely, go for one more.
there has been criticism of the back-to-school plan as being too relaxed. Does this situation now justify those criticisms as founded?
Look, I think since, I'll start first, but I think since we've started in this, that, that part of the job is there's a regular critique of what you do and how you do it. There's been no shortage of why did you do this or why didn't you do that? And I think that's normal. I think that's an important part of the democratic process, to be honest, is that people have to have a will and an opportunity to share that critique with us. I mean, I think we have been consistent from the beginning of following the best evidence and research that we have and not making, emotional decisions on our protocols. I think when we were developing our back-to-school plan, we built it for just what we're dealing with here, and that is the realization that there may very well be COVID pop up, in particular with those who are unvaccinated. What was different this year compared to last year was the fact that 85 or close to 85% of Islanders who are eligible for the vaccine are fully vaccinated. We had very limited transmission of the virus throughout the summer, et cetera, and we were trying very hard to balance that delicate line of giving people more room to move with the protections that we have in place, including our border protocols. But I would say to those who Monday morning quarterback this, that these aren't easy decisions. These aren't easy positions to be in. I don't think we would do anything differently. I think we plan for where we're at. And we're perhaps here a little bit sooner, as Dr. Morrison has said a couple times, a little sooner than we thought or maybe had hoped that we would get there. But our job, is to keep as many people safe as we possibly can and to do everything we can as fast as we can to do that. And to date, that has worked for us. We're dealing with something that other jurisdictions have dealt with a lot sooner than us right now, and we're working hard to contain that. But so whether or not somebody was right about what they said yesterday or 2 days ago, I don't know how to answer that, to be honest. And we're just taking the best advice that we can and implementing it and trying to help as many people as we can. And so far, our record in PEI has been really good, and I'm proud of that.
I agree. I mean, just to add to that, we mentioned yesterday, this is our first school outbreak of COVID-19 in 19 months. And we were one of the provinces that had in-class learning for that whole time. So I think we are recognizing, and this is really, education can speak to this probably better than I can, but the importance of learning and development that occurs with in-person learning is important. So certainly balancing that with some of the things that we have in place. So there was masking requirements as we went back to school. People have only been back to school for 4 or 5 days. It seems like a long time. But masks, we have good vaccination rates in the province. Screening was in place, cleaning was in place. And so how do you adjust then if we need to? And I think that's what we're doing and working with the school system to do that.
Thank you.
Thank you, Brian. And we have some calls online, I'm assuming?
Dave Stewart, The Guardian.
Good afternoon, Dr. Morrison and Premier King. I guess my first question would be to Dr. Morrison. With parents, island parents, whose children are 11 and under, in light of what's been going on the last few weeks, what can islanders do? What can these islanders do to make their kid to protect their children? What is the message?
I think that's a great question, Dave. So I think one of the things, and I'm a parent as well, of 2 of my 4 children are in that age group. And I mean, one of the things that I would be saying to all parents is make sure that that parents and the other people in the household and are vaccinated, because then it will reduce the chance that if I get COVID, I would spread it to my unvaccinated children. I think making sure that that they wash their hands. It sounds so basic, but it's actually harder to get them to do than you would think, and making sure that they don't go to school and they're sick, because I don't want them to impact others. And I think we talked about it yesterday, and this is certainly in line with some of the modeling across the country, that as we go into this 4th wave that we're seeing, trying to really consider the number of close contacts we have, if we can reduce the close contacts we have in the next couple of months by 25% as a country, it may have an impact on the 4th wave. I mean, that's at a population level, but we may want to consider doing that as families as well. And I think we balance that with what we know is important, that children also have interactions and have that chance to play and chance to do activities, and I think we've tried to walk that line. So I guess all the same things that I'd be saying to a parent even in non-COVID times probably apply as well. And also, I mean, my children would put a mask on if they go into the store. So trying to make sure that they use their mask if they're in indoor public places, and that's the same advice I'd give to anybody.
Thank you very much. I guess a follow-up question would be kind of built on what you have said in your previous 2 briefings. Are we any closer to knowing when a vaccine will be available to those under 11?
Hi, Dave. I think we don't have a date for the vaccine. Certainly the updates that I get are that the trials are ongoing. We anticipate submissions to Health Canada, initially from Pfizer, likely before we have a submission for Moderna. It will be for those 5 to 11 is what we anticipate, but I do not anticipate that we'll hear further about that vaccine until later fall, early winter, and then there has to be the availability of the vaccine. So it is not in the next few weeks, but certainly sometime this winter, and I'm hoping it'll be early winter.
Thank you very much. Appreciate your time.
Appreciate it. Thank you.
Steve Bruce, CBC.
Yes, hello to you both. I'm wondering if you could talk about child care centers. Is anything changing with protocols at daycares in light of this outbreak? And I guess in particular those that offer programs for school-age kids in the Charlottetown area. We've heard from some of them wondering whether they should even be open right now. What would you say to those centers?
Well, I mean, I think at this point in time, our cases are have not included daycare age children yet, and I hope that doesn't happen. We have guidance in place. I did request, and I received today the early childhood educators' vaccination rates. I saw the email come through. I haven't had a chance to open it yet, but we'll be looking at that as well. And those who are looking at our early childhood guidance that we have put in place are certainly reviewing that. And they reviewed it actually in August, and I know they'll be looking at it again. So at this point in time, I don't think we've made any particular changes to early childhood direction yet, but we certainly will. We're keeping it at the forefront of our minds in the days ahead.
In particular, though, those that do have, after-school programs, we know there are some that are taking in those school-age kids today, potentially from various schools. Is there any concerns there about those school-age kids going to a daycare right now?
Well, I think my general advice would be they need to be very well screened, make sure that they're not sick. Any close contacts, of course, would not be able to go if they've been identified as close contacts of a case. And I think that some of those decisions would be up to the actual individual programs themselves. I haven't received any specific question about a particular program, but certainly would be happy that our office would certainly take those questions if any of the after-school programs that are taking other children in have any questions.
Understood. And another topic you mentioned, you may start doing more testing at points of entry. Can you elaborate on that? Who might you start testing that you're not currently testing right now?
Well, I think the Premier and I have sort of had a conversation, and I certainly have started those conversations with the team, and we will have a further update either tomorrow or Wednesday on that.
Yeah, the only thing that I would add, Steve, is that, we had a pretty strong run of people coming to our borders, obviously with the tourist season, and with that starting to reduce now that everyone across the country is back to school and the weather is, about to change or will change. That might give us some capacity to broaden what Dr. Morrison is talking about. So I think once we learn a little bit more about what is actually going on here in these schools and then the testing, et cetera, I think we will then take that information as we have done from the beginning and use it to see what we can do to enhance our measures to reduce the spread, and that will likely include enhanced screening and testing at the points of entry.
Okay, thanks so much.
Thanks.
Gabrielle Drummond, Radio Canada.
Good afternoon to you both. Ma question c'est en français pour la docteure de Morrison. Docteur Morrison, vous avez répondu déjà en anglais, mais j'aimerais savoir qu'est-ce qu'on sait sur la source de cette éclosion, comment le virus s'est propagé dans ces écoles, et est-ce que l'ampleur de cette éclosion vous inquiète?
Bonjour Gabrielle. J'ai manqué des questions en français hier, alors c'est un plaisir.
Je suis là.
Alors, qu'est-ce qu'on sait? Vraiment, on annonce 4 cas qui sont liés aux écoles aujourd'hui. Et puis 3 des cas sont à West Royalty et un des cas à Charlottetown Rural. Et on ne sait pas vraiment la source de les cas à Charlottetown Rural, non les cas à West Royalty. On n'a pas un lien entre les deux écoles, et puis il n'y a pas un lien à ce moment qu'on sait qui est lié au voyage hors du province. Alors, on est en train de tester beaucoup de personnes, 300 personnes qui sont testées depuis le week-end. On attend, je pense, à 680 tests au moins qui sont pas, on n'a pas les résultats encore. Alors, ça, vraiment, ça m'inquiète. C'est vraiment la première outbreak dans une école qu'on a eue depuis le commencement du pandémie ici à l'île du Prince-Édouard. Alors, j'espère en premier que les enfants vont pas être très malades. J'espère qu'ils ne vont pas avoir beaucoup d'enfants qui ont le COVID-19 et j'espère qu'on peut limiter la transmission.
Good?
Okay.
Oh, all right. Thank you very much, Dr. Morse. Thanks to Stu and Brian for being here and for our friends in the media for joining online. And we will be back tomorrow, I'm assuming, with a little bit more information. So thank you very much.